Hello and welcome to another Facebook Live, and today we are here to discuss a topic called TMJ, and I'm discussing this because we have one of our practice members who said, hey, can you talk a little bit about TMJ? And it kind of made me think a little bit that we all have TMJ. Like any profession, the people on the inside kind of know the terminology, and those on the outside don't really understand. But we all have TMJ because really what that stands for is temporal mandibular joint. And so if you're suffering from pain in your temporal mandibular joint or any kinds of problems, you have clicking or popping or issues opening and closing the jaw, it's actually referred to as TMD or TMJD, which is temporal mandibular dysfunction or temporal mandibular joint disorder or something along those lines. So we all have TMJ. So before I get started on that, my name is Dr. Andrew Smith from the Head and Neck Centers of Excellence, and again we're here to talk about TMJD, and I'm going to give you my top 3 go-to strategies that if you have these issues, what you may want to be doing routinely to maybe help yourself navigate through and help alleviate some of these complex issues. There's lots of different things that someone needs to consider if they have these type of issues, so you don't want to just go pulling and pressing on certain things. You really want to know what you're doing and get a proper evaluation. So having said that, let's dive right into my top 3 strategies for TMJD kind of self-care at home that you can do. When we're talking about that disorder, I'm going to talk a little bit. I'll bring our trusty friend Gertrude. For those of you who have seen us before, you've met Gertrude, and she's looking better than ever today on this beautiful Tuesday. Anyway, our jaw is, we have this guy here. This is the temporal mandibular joint. And this joint actually, as your jaw opens, the joint actually comes out a little bit and then your jaw descends. So inside that joint is actually a disc and cartilage and ligaments. So if the disc could rupture or irritate, it could be a big problem. And if it's left untreated, uncorrected for too long, boy, you may even need like a surgical procedure. So that's a small percentage of the time, but that can be really, really uncomfortable for some people. So what we want to do is we want to manage this problem. Now, typically when somebody has temporal mandibular joint issues, they also get headaches and or neck pain. And usually the 3 come together. Not every time, but a great majority of the time. And the reason is they're very intricately related. So you'll see that the muscles from the jaw actually attach into this area here, and this is called the temporal area of the skull, and that's the temporalis muscle. And then we have this large muscle running along the jaw here. That's called the mandibular or the masseter muscle that runs over this mandibula. And then of course muscles from the back of your head and your neck actually attach and control the jaw from underneath. So you've got this all integral relationship going on, and all 3 need to be kind of looked at, assessed, and worked on. The first thing I recommend folks do when they tell me they have TMJD is maybe go to their oral care provider. Make sure they don't have any dental issues, make sure there's no occlusions or imbalances in the actual teeth themselves. Sometimes that's the case, and they need to get kind of worked up from their oral care professional. Sometimes that's not the case, or is just a small part of the problem, but a lot of times things like stress, where you grind and clench your teeth at night, can stress out that joint. Obviously, direct trauma to the jaw itself can kind of create long-term problems with that joint. A lot of times you have poor posture, so the head constantly pushing forward at a computer. You've heard me talk about your smartphones before. That can kind of stress out and push that mandible and irritate these jaw muscles and create TMD. So those are the big culprits that we typically will find will create these problems. So what do you do about this? Well, assuming you have had evaluation from some of the professionals that deal with this thing, what you want to do, my top 3 tricks are as follows. The first one that you might want to do is actually start to work on that temporal area. So basically you take the heels of your hands and you want to kind of cup right over that temporal area and just gently push your hands together, and an upward motion, basically rising that tissue up. And you may want to do that 10 times in a circular motion like this. So basically a clockwards forward motion 10 times, and then you want to reverse it 10 times in the opposite direction. And what that does is it begins to loosen up the temporal tissue and relieve some tension on the jaw. when you do these movements, I want you to keep in mind that you can't just think, hey, I'll do it once, and I'm done, Typically with most exercises, it's a routine, and you have to learn to discipline yourself, especially if you have disorders in the jaw. You're going to want to do these things regularly. So that first tip is to work these temporalis muscles. My tip number 2 is to now work the actual joint itself with those masseter muscles. So you take these fingers and you're actually going to find the joint. So it's usually right in front of your ear. And as you open your jaw, you'll kind of feel the indentation. You'll feel the jaw come down, and you'll feel the movement kind of in this area. And so what you want to do is, if you're feeling and you notice one jaw bone falls or drops first before the other, in other words, it opens first, then that's the one you want to work on. So let's suppose in this scenario, this jaw, I do this test, and this lowers first. I want to take the heel of my hand again, and I want to kind of push right up underneath that jaw. And as I open my jaw, I want to push directly gentle pressure up. And it'll look something like this. And so what you're doing is you're gliding this pushing pressure on that joint as you lower your mandible. The part 2 to that is, let's suppose you're checking and then you notice one side closes before the other. Well, then you want to actually do the opposite movement. So let's say you're testing and you notice that this side of your jaw is actually closing first. What you want to do is you want to take the heel of your hand, and in this case, as you close your jaw, you want to push downward. So it'll look like this. Okay, as you close, you want to push downwards. And again, what this is doing is it's helping reposition and reset some of the biomechanics of the jaw alignment itself. And then you can constantly recheck, okay, to make sure that it's starting to work and start to heal and get better. My third tip is working a little bit on your posture. Now, there's many ways. You've heard me talk on some other videos about how to work your posture in your neck. But one of the best things that I like to do for people who have jaw issues, and I've seen this work effectively, is you want to take your fingers and you want to find your spinal bones of your neck, and you want to come about maybe a half an inch to an inch apart, and you want to start to, as you extend your neck back, you're going to pull your hands forward. So I'm going to turn around and look something like this. And you want to do that for about 10 times. And so if you do all 3 of those maneuvers 10 times throughout the day, a few times a day, that's when you're going to get the best kind of outcome and relief from temporomandibular joint disorder or dysfunction. So if you're listening to this and you have somebody you know who is suffering from these type of issues, make sure you share this with them, tag them in. Maybe they're not doing these movements, and maybe it'll give them tremendous relief. If you yourself have this condition and you found some value, make sure you like this video. Make sure that you like our homepage, the Head and Neck Centers of Excellence, so that we know that you enjoyed some of the material. And if, as always, if you have any questions, you can feel free to comment. PM me privately, and I'll make sure I get back to you as quickly as I can. And as always, hope you're having a healthy day. I'll see you guys next time. All right, take care. Bye-bye.